Dr. Zach back on the show. We're going to be talking kidney stones, but Dr. Zach, before we get to that, we just saw that shot outside. A lot of snow has accumulated here in Montreal, over 30 centimeters, and just again a warning for people that are, they're getting up right now, probably going to go shovel the driveway, shovel out their car. They need to be careful.
Yeah, exactly. If you're not used to it, I mean, I'm going to be shoveling later too, but and most of us are not used to it. Even if you're physically fit, we're not used to doing that motion. So even if you're physically fit, you may not be at risk. If you're cardiovascularly fit, maybe you're not going to have a heart attack. That's good, but you can still pull a muscle on your back, and you can still injure yourself otherwise. So take it slow. You don't have to clear it all in one shot.
And then the risk of heart attack.
Yeah. So if you're not used to doing any kind of physical activity, and you get out there and you start, trying to lift 50 pounds of snow in an hour, yeah, we definitely see an uptick in heart attack just because you're straining your heart. This is a significant strain cardiovascularly, and if you're not used to that, then your heart can say, whoa,
Yeah.
Yeah. It can give you a warning too, just say, stop it, or it can be a full-fledged heart attack.
Ironically enough, you're on the show to talk about kidney stones. I was telling you during the break, my father's had kidney stones. I've had kidney stones. I just had a bladder stone removed, which I'd never heard of until I got one. But let's talk kidney stones in particular. How common are they?
They're common. I mean, in general, they're about 10% of the population.
Okay.
Although, I would have guessed more, because working in the emergency department, we see it at least every day. At least every day someone comes in, and it's, as you know, excruciating pain.
Yeah.
It does tend to run in families, more common. It's a bit more common in men, but women get it almost just as much.
So what are they exactly?
So basically, we all have these little solutes, like little pieces of things that are not liquid in our urine. So our kidneys are constantly filtering the blood, getting rid of the waste products. And we all have these little solutes. And if we get supersaturation, so too much of these certain solutes, the main ones being calcium is a big one, oxalate, uric acid is another one. But we all have that. It's just an issue. Some people are stone makers and some aren't. But the good news is, if you can figure out exactly what the stone is made from, you can make some changes to try and decrease the risk of getting them in future.
Okay, so what sort of changes can you make then?
So the reason that we always refer people to a urologist afterwards is they have to do tests. So I would never say, oh, to everyone who has kidney stones, oh, stop, decrease your calcium intake, because a lot of people need calcium.
Right, of course.
I may recommend, well, the urologist has to do tests to see what kind of stone it is, and they may say decrease calcium intake from supplements. So definitely calcium supplements, if you're a calcium stone maker, can increase your risk of making stones. It's better to get your calcium from, from other sources like milk and cheese and whatnot. And then there are other things. Some people are uric acid stone makers, so in those people we might say decrease your protein intake, decrease your salt intake. So it really depends on the type of stone. And for everyone, though, it's a good idea to increase your fluid intake.
Right.
And fluid being mainly water, alcohol and caffeinated drinks are not as good.
That's not the kind of fluid you're talking about.
Exactly.
What about the symptoms? What are the typical symptoms that we see with kidney stones?
Typical is pain. We talked about it before. Like, typical is pain. It usually starts with back pain, like lower back pain, and it wraps around to the front, to the lower abdomen and into the groin. And it can be terrible, right? You can get these huge, big football players who are in the fetal position on the floor crying.
Oh, yeah. I've been there. It's not nice.
And it's not a matter of the size either. So sometimes people will come in there, and I'll say, oh, yeah, you do have a stone. And they'll be like, oh, how big is it? Is it like 10 feet? And like, oh, no, it's 3 millimeters. And they're like, oh, well, why did I have so much? It's not necessarily a matter of the size. It's just a matter of, it's like a little stone or a ball or something being pushed through a little tube, like a straw. And
oftentimes it's a sharp little stone too, right?
Exactly. It depends on the orientation. So even a 3 millimeter stone can be extremely painful. So it's not to say, now they do pass more, it's more likely to pass if they're smaller. So if they're less than 6 millimeters, more likely to pass on its own. As you know, they don't always pass on their own. Although the good news is about 85% do pass on their own.
Okay.
That doesn't mean without pain medication. We have to treat the pain, and very often with intravenous morphine and
so
stuff like
that's
that.
the treatment. You go to see the urologist, or even if you went into the ER to see someone like yourself, of course, you would give them some medication for the pain, but then they have to follow up, right? With a urologist.
So the treatments are pain medications. There is a medication we give to try and help it pass. Anti-inflammatory medications help as well, and fluids. We always give them fluids. And the reason that we follow up is to try and prevent future episodes. And then also, if they don't pass, in some cases we actually have to keep people. If they can't pass on their own, if the pain is not controlled, or if there's infection associated with it, then they actually have to stay. And then the urologist gets involved. And as you know, there are different methods of getting rid of stones that just won't pass on their own.
Right. Great advice as usual, Dr. Zach. Really
Thank you.
appreciate it. There's
Good
a
to
lot
be here.
more information, by the way, that we didn't get to. So you can visit our website, btmontreal.ca/blogs, to find out all you need to know about kidney stones.